So this is a huge difference. Augmentation with implant, it's mostly use it for the patient that they want a size bigger than 2 cups or 3 cups. Because with the fat transfer, it's more suitable for the patient that we do a combined procedure, mostly if we do a liposuction and we use that fat to add it to the breast. The second feature with the fat transfer to the breast is that we cannot have an augmentation bigger than 1 cup, 1 cup and a half. We have all of the resorption of the fat that we injected, and so after one session we cannot expect more 1 cup and 1 cup and a half, which is not the case with the implants. So if the patient, the main interest for her is to get the augmentation with a size which is making maybe 2 cups, so it's better to move to the implants. So the fat is removed by the technique of the liposuction, which is any technique, but mostly these technique that are not destroying the fat that we remove. So soft liposuction for me is the best, with a very thin cannula, not very thin, but a thin cannula, not a 5 or 6, maybe between 3 and 4 diameter cannula. This fat is prepared and decanted, centrifugated, and washed. Now, we prefer not to use this procedure under local anesthetic because the local anesthetic may destroy the fat. So we suggest to do this procedure under general, because if we don't do local, so it's impossible to get the fat removed without any anesthesia. And mostly we treat 2 procedures on the same time. So like that, we remove the fat by doing a liposuction and adding the fat. So we have 2 procedures in one. The recovery for this procedure is like a liposuction, and depending on how many areas that we treated. So, but it ranges between 4 days to 1 week. The patient needs to wear a garment for the liposuction and a support bra for the breast. Now, just after the procedure, there will be some swelling, and then the result become stable within the next months. So we prefer to do these cases with a stable weight, because if the patient is always, losing and gaining weight, this may be not the solution for this patient, because we will not have the right size. So we advise the patient to get really a stable weight before doing this procedure, and we give them all the information about this procedure, like that they know everything about it, and mostly about the results, because as we said, that it's not suitable for the patient that they want 2 or 3 cup sizes, because we cannot reach that with one session. So we need to tell them that if they are not happy with the result, which will be stable after 6 months to 8 months, they can do another session, but they have to have really a reasonable expectation for this procedure. It's important to choose your plastic surgeon, so it's a kind of confidence between two. So it's between the patient and the surgeon. The patient needs to feel comfortable with the surgeon to go ahead with the procedure, because as we say, it's the plastic surgery, or the procedure. It's not the day of the procedure only, it's the before and after. I prefer to see my patient at least 2 times before the surgery to explain to them the procedure, and to feel that they understood all that we said before. Then we do the surgery, and then we have also the follow-ups, which are very important to keep really in touch with the patient. For the patient, this is the first time, so there will be some swelling, decreasing of the size, changing of the sizes, bruising. So if the patient and the surgeon is not reachable to, or the nurse or the surgeon or the PA is not reachable to reply and answer this question, so this may be frustrated for the patient, could be interpreted with some kind of problems which are not the problems, and the patient may go to see another doctor, and there will be some problem. So we need really to have a very close of confidence between the two.